Thank you very much. Uh, please can you- I will be comfortable from here only. That is not important. Yeah, and my. A very good afternoon, everyone, and thanks to the organizer, especially Mr. Utsav, who is the director of the BCOR vertical of the RRU, and we have been in touch since past few months to, make it happen for the anti-doping workshop, seminar, and today the day is come. So let's start something about the overview of the anti-doping, and Professor Yanis has already touched based upon the, the research angle from the WADA and the international practices that is going upon, and so many, papers he has produced, he has published for the purpose of the, benefit of the audience and the public. So next piece. I am working in NADA, National Anti-Doping Agency, which is an autonomous body of the Ministry of Youth Affairs and Sports Government of India. The mandate is to create a dope-free environment and to promote the best practices, clean practices in sports in our country. So just to start with the anti-doping framework, what is the, the binding of the government and the commitment of the government being a state party to the UNESCO Convention. I will just go through the principle of the Convention of the Doping in Sports, which has been ratified by the Government of India in the very beginning in 2007 only. And this originates or give the generation of the WADA code, which is the World Anti-Doping Code, based on the UNESCO Convention, highlighting the principles and the commitment of the state parties, and the National Anti-Doping Rules, which is the domestic rules applicable for the sports stakeholders of the country for the implementation of the doping control program. What is the UNESCO International Convention? We all know that there is an international convention against the doping in sports, highlighting that this is not a single country or the region's issues or the problem. This is a worldwide global issue that jointly we have to address this, and the government is also one of the state party of this convention. And at present, over than around 200 countries all across the globe has signed this convention and abiding the principle of the and objectives. Basically, there are three pillars around this convention which combating the doping in sports. The one is the international cooperation and the capacity building and the education and prevention program, which also involve the research practices that needs to be promoted. If we talk about the commitment under the convention by the state parties, then I can highlight some of the 5 key commitments under the convention. First is the anti-doping activities to promote the clean sports anti-doping activities at domestic level. Second one is the international cooperation, which involve the cooperation and the consultation and the exchange of best practices all across the world for any anti-doping organization. Next one is education and training, which is very important for a developing countries from the sports developing perspective of any country, that athletes and the anti-doping staffs and the athlete support personnel needs to be familiarized, educated with regard to the harmful effects of the doping and unfair means. Article 5 of the convention says that measures to achieve the objective of the convention. A state parties has a commitment to adopt that education and training program for the implementation in respective countries. Next, with related to the today's workshop on anti-doping research. Research article 24 states that we have to promote the anti-doping research practices in every country. And what are those areas basically to promote the research activities is the prevention, detection methods, behavioral and social aspects, and the health consequences of the doping. I will touch upon the key areas that WADA is also promoting the research for any country to adopt, ways and means of logical and psychological training programs. That is also very important for any research topics to be chosen across. The use of all emerging substances which relates to the analytical capacity of the laboratory, which is WADA accredited laboratory, to use such and such innovative methods and technology to adopt the detection of the prohibited substances. Nature of the anti-doping research, if we talk about that, we have to ensure that any anti-doping research will comply with the internationally recognized ethical practices that is put or to be framed by a respective organization promoting the research. Second is the avoid the administration of the prohibited substances to the athletes. This is also one of the second area that has to be ensured that to the best possible extent we have to avoid the use or administration of the prohibited substances among the athletes, and undertaken only with adequate precaution in place to prevent the results of the anti-doping research being misused or applied for the doping. World Anti-Doping Code is one of the parallel document enlightening the principles of the anti-doping, which is a global document. We can say that uniformity has to maintain fundamental aspects of the anti-doping principles. The code is being revised time to time, and at present we have a recent version of the 2021 WADA code, which is applicable all across the world. Now the next version is already be in place, which is going to be effective from 1st January 2027 next year. The code and the related international standards has already been published on the WADA website, and which is ready for the implementation for any respective stakeholders and the countries or the international federations. Purpose of the code, we all know that to protect the athletes' fundamental rights to participate in doping-free sports, and to ensure harmonized and coordinated approach or the implementation of the anti-doping program at national and global level. Within the code, WADA code, we have international standards for any stakeholders to implement their anti-doping program. Basically, we have at present 8 standards, including the standards for the testing, standard for the code compliance of the signatories, result management, laboratories, and privacy or protection of privacy documents. And these 2 standards, in the end, you can see that 7 and 8 standard for result management and standard for education. That is the new standards which came only in 2021, and we are implementing as a stakeholders in respective countries. This IAC tells about the uniform efforts being conducted by any stakeholders to educate and aware the athletes and the support staff in their country. See, every country has been developing their own anti-doping education program, but to harmonize with regard to the standards for the education and testing, we have to see that these programs are uniform. At least a limit of the population has to receive a target-based approach and topic-wise delivery of the anti-doping program. That is why this international standard for the education has come into place. If we talk about the anti-doping program being implemented in India, we have 2 nodal agencies for implementation of this program. The National Anti-Doping Agency is the authority for conducting, collecting, planning the dope samples all across the competitions and the training camps, result management of adverse analytical finding cases that we received from the laboratories, and the education. Next department and the laboratory, which is an independent autonomous body under the Ministry of Sports, is the National Dope Testing Laboratory, which primarily involves in sample analysis and reporting the results to the laboratory, in addition to research and education. The National Anti-Doping Rules of NADA, which is currently 2021 version, is applicable in the country, and this has been revised time to time as according to the World Anti-Doping Code. As and when the WADA code revised, we also implement and update our existing anti-doping rules. The 2027 code, which I said that it is going to be effective from 1st January of 2027, and we are also in phases of implementation of our current anti-doping rules, which has to be effective from 1st January next year. We all know that doping is a overall performance enhancement, which is a violation of the one of the anti-doping rules as defined by the WADA code. There are total 11 types of anti-doping rule violation. We have to understand that I can see that some of the participants in this room can understand that the consumption of the prohibited substance is the doping or the anti-doping rule violation. But technically, there are 10 more anti-doping rule violation or the act or the misconduct on the athlete or athlete support personal's parts, which constitute the anti-doping rule violation. You can see here the first 4 of the violation as defined by the WADA code is applied to the athletes only, and the next 7 of the anti-doping rule violation like possession, trafficking, complicity, prohibited association, etc. This applies athlete support personnel, and any other person of the country where the anti-doping program is being run. Of course, the sanction, we discuss about the stringent punishment for the dopers who found guilty for violating the anti-doping rules. At present, it is 4-year standard punishment for the violation of the some substances which is non-specified category of the WADA prohibited list, and also the repeated violation or the dopers can be sanctioned for up to a increased period of ineligibility, including the lifetime ineligibility provision is also there. But definitely, we discussed that this period sometimes it is not to the appropriate, or sometimes they take the chance for getting sanction of 2 years or 3 years ban, and that is why this doping issue is being arose. Core function, I discussed the anti-doping agency's functions in the country is the implementation of the dope testing rules, planning and execution of dope testing of the athletes all across the country, result management of the anti-doping rule violation, gathering intelligence, investigation, planning, organizing education, international cooperation, and intelligence, and promoting science and research on anti-doping science. We are working on that aspect, and if I can skip this, this is the intelligence and information gathering platform portal adopted by the National Anti-Doping Agency. As WADA promotes that any whistleblower program has to be put in place by anti-doping organization, and any participants or any person of the country can discretionally inform the authority about any suspected doping activities which is being taken place anywhere, and we can act accordingly. We can put some more intelligence and investigate the cases accordingly. Now we talk about the education program. India is a big country, and we know that every corners and the region has a special challenges with regard to the language barrier or cultural diversity and so many other issues. We are trying to develop some more educational digital content on anti-doping topics, and we have designed toolkits for encouraging among the young athletes, and also we are working with the education administrative ministry for inculcating some the school level education program for the school level children, so that it can be a part of the national curriculum framework for the education in the country. This is also very important steps and initiative taken by the National Anti-Doping Agency in the previous past year, and to address the issue of medication in our country by the athlete, we have launched a Know Your Medicine app, KYM app. This is a very useful app which can immediately tells upon the nature of the drugs which is prohibited or otherwise allowed by the WADA and the NADA. Any athlete can search filling the requisite detail, primary detail like name, email ID, contact number, etc., and search this medicine app and get to know the results within 30 seconds that this particular substances is prohibited or otherwise allowed. In case of prohibited, then they have to apply for a therapeutic use exemption for the granting of using of that particular substances. So we have at around more than 8,000 active downloads of this Android and iOS application of this app, and more than 4 lakhs of searches of any prohibited medicines as on date. So this network is being increased on day-to-day basis, and we also promote, encourage the audience sitting in this room that you can please share this information amongst your colleagues and peers so that this can be reached to the audience at a large scale. Now we know that some of the factors that increase the cases of the detection of the doping. We know that India is on the top of the list of the globally for the violation of the anti-doping rules. And we have seen that there are so many factors influencing those dopers, and one of the major cause of this positive cases of the doping is the supplements, nutritional supplements availability, and irregulatory mechanism in place, which is one of the major cause for the inadvertent doping. But the rules are very strict. We know that the principle of strict liability applies to the athlete in case of any findings, adverse finding is there in the athlete sample. It has to be treated as a principle of strict liability, and athlete has a bonus to establish that whether what was the intention of that athletes to take or to use of this performance enhancing medicines or the drugs. There are few risks associated with the using of nutritional supplements. We all know that mislabeling is there, ingredients listed in the wrong doses or the information at the top or the bottle, outer coverage of the supplements, contamination issue. Sometime during the manufacturing process, the adulteration can happen to any supplements if the quality control is not up to that mark or checked at a quality insurance department. Fake or low quality products, sometimes the manufacturer try to manufacture the supplements which is a very low quality and very cheap with regard to the costing the money. Sometimes this happens during the processing and all. False claim also one of the issue that we are facing, that there is no scientific, there is no evidences based research for consuming any supplements, but we see that there are so many influencers and celebrities, they promote that supplements for the use of sports persons. So one can be informed about the side effects and the challenges of the supplements use, and this can be one of the way to escape of the inadvertent anti-doping rule violation. And the athlete has to be clearly informed and sensitized about the risk involved before using any supplement. The athlete has to consult the qualified nutritionist and then only decide the use of any nutritional supplements which can be contaminated or adulterated. And all this information and the research that athletes do at their level, they have to keep the records of these searches or the inquiries made by the athletes, so that in case of later stage, if there is a finding of the anti-doping rules or adverse finding, then this can be produced by the athlete before the tribunal for getting any relaxation to prove the his or her intention before using the supplement. There is a relaxation. I am telling this thing because the athlete has to keep the records, and because the code provides the relaxation when consuming the contaminated supplements by the athlete, and athlete can establish that the positive findings in the blood or urine sample has happened due to the contaminated products or the supplements. Then there is a clear-cut reduction in the sanction period to a minimum reprimand to a 2 years reason relaxation can be given by the committee. To address this issue of contamination of the nutrition supplements in our country, we have initiated some 3 years back with the guidance of the Ministry of Sports Department and with the partnership of some of the 2 identified laboratory. One is in Hyderabad and second one is here we are discussing the matter in the Gandhinagar, NFSU. As a result of this collaboration and the memorandum of understanding, We have worked for 2 years and to develop the capacity of these two existing laboratory. And now we have such facility to test and certify any nutritional supplements which is being produced in our country. And the manufacturer and the promoter of these supplements are advised by the controlling authority to get the certification done by these two identified laboratories and get the certification published in their website, so that our sports persons can check thoroughly and ask from the manufacturer about the certification. This can be a help for the sports person before consumption of any supplements and make them confident about using this substance. Now, second part of my today's talk is the research on anti-doping science, especially social science research grant, which is promoted by the World Anti-Doping Agency. And so many students and scholars sitting in this room can go through the detail at a later stage, and they can apply for a grant for doing this research. If we talk about the grant program objective of the WADA, then it is established and published research priorities. There are main four theme of the promoting the social science research is that engagement of the athletes is very important. It has to be athlete-centric. ADO's involvement is to be there. One has to, any university candidates or scholars, if promoting the or writing any project for the social science on anti-doping, then they have to take the assistance and collaboration of the concerned anti-doping organization, and to reduce duplication. Any innovative studies is to be promoted. It is not just a duplicate of any study that is being carried out or being done in the recent past. Dissemination of research information and the outcome of the study is to be widely publicized by the participants. If we talk about the research priorities of the WADA, then there are 6 major themes of, aligning the research areas. And in one theme, there are 2 sub-themes under research priorities. You can see that the society in large, sports environment, WADA program, educational program, athlete support personnel, and the athlete. These are the 6 key principles of the research areas. What are the inquiries supposed to be received from the participants and any young researchers? You can see that if we talk about the athlete support personnel, and the behavior and the experience, these are the information that is available on the WADA website for indicative areas of inquiry. If we talk about the budget scales and the tier approach research program of the WADA, then you can see that there are 3 tiers approach presently: tier 1, 2, and 3. Tier 1 is the topmost, and the most, weightage, I can say, and the thorough research studies and the project plan is to be given under the grant of the tier 1 program. Tier 2 is the middle one, which can be involving some single sports study also, interdisciplinary team. And tier 3 is the pyramid at the bottom program, which is in our country also. We have promoted one of the university scholar for getting this grant from the WADA, and he has received successfully this grant, and he is working on this particular social science research and to promote the small scale projects. Funding pattern is there. Tier 3 program can be funded less than the 20,000 USD annually, and to encourage the young researchers. Grant requirement is very simple. One can apply with the principal investigator's profile and a letter of support, team of the CVs of the CVs of the team which are involved in that particular research, project plan, grant chart, etc., and with budget template. That can be a format adopted by WADA, and one can easily apply. If we talk about the National Anti-Doping Agency's initiative to promote the research on social science, we have 2 schemes at present with the budgetary assistance from the Ministry of Youth Affairs and Sports. And objective is to capacity building in sports governance, anti-doping administration, education, research, legal, and compliance function. These are the main field that we encourage the researchers to write a project and submit it to the NADA. And there are two internships conducted every year, January and July of every year. There is a 6-month cycle. And internship eligibility, duration, and other guidelines is there. You can see in the website of NADA for further details. But undergraduate, postgraduate students, or any research scholars of any recognized university are the eligible candidate. Duration is the 6 month. Application invited through NADA's website or portal or MAS internship portal. Currently, it is being on. We have 3 days left. If anyone interested candidate can approach or apply. The last date is the 31st January for the January to June cycle of this year. These are the roles and responsibilities of the, supporting the anti-doping education awareness activities, basically exposure to the testing procedure, result management, and these are the basic requirement of the things. Stipend is not a concern. The scholar needs to be thoroughly, mentored through the experts, but for the pocket money allowances and all, we have fixed the 20,000 rupees per month for the stipend of the interns to be adopted by the NADA, and there are supervisory role and expertise being provided by the department. Second scheme is the OTA scheme, one-time assistant grant scheme. This is applicable for the PhD scholars, those who are involving in the research studies or any fellowships or the university and the college or the institute. And OTA grant of 50,000 rupees per time is being given to those candidates selected for the conducting the research. And we have total 10 seats annually for the PhD scholars to promote this anti-doping research topics, and technical guidance obviously being provided by the expert jointly by the PI. Eligibility criteria and the application process is very simple. Any candidate holding the master's degree in these specialized area can be recognized and made eligible for the synopsis and all, and they can apply for a OTA scheme. Fund released by NADA to scholars through host institution. This is very important that we are not releasing the grant directly to the scholar. We are releasing through the institution or the concerned university, and they can finally forward this grant to the two-stage selection, screening of application followed by a direct interview. And these are the areas you can see that the academics, certificates, categories of the proofs, ethics committee approval required for a particular university or the institute, those who are jointly promoting this research. This is all about the research practices that is being promoted by us, and for further information and updates, you can follow like the social media handles of NADA and visit our website. Thank you, everyone. Any question?
Thank you, Dr. Ankush. The floor is now open for questions again.
Any question, please? Any query?
Please.
So what about equestrian doping, sir? Horse, animal doping, sir. Equestrian doping.
Frequency.
Equestrian, horse doping, animal events.
Horse doping.
So we did not touch on that, right, sir?
Yeah, actually this is not the direct mandate of the anti-doping organization. This mandate has been shifted to the concerned federation, whether it is national federation or international federation. They can make an arrangement and expertise to collect the samples of the horses, and the laboratories, which is a WADA accredited laboratory, can analyze those samples for the horse. Any more, please?
Sir, in India, we also use other kinds of medicines like homeopathy or naturopathy. So can you give a brief about how those medicines are considered in anti-doping?
A very good question. Not in India, in other countries also, this is the issue that any local therapy or medicinal purposes drugs are used sometimes, but it is very simple that the World Anti-Doping Agency has identified some of the drugs with the metabolites and the markers of any particular chemical composition or the formula. And the laboratory is going to analyze the sample, screen the sample, and in case of any combination similar to the original drugs or the parent compounds is resembling the, the detection or the peaks, then this comes to the anti-doping adverse analytical finding. But to address those issues, we are promoting, that is why the research, especially this is also one of the research area that can be worked upon to deal these cases of, local therapies use and all. But at present, it is a gray area, I can see, and one cannot, address this challenge at present. Because the if you talk about the practices or the international standard for, international pharmacopoeia methodology, the pharmacy is defined, and as a English or allopathic, practices of drugs, it is clearly defined and documented. But not in local or regional medicines, it is a challenge that the component and the names and the ingredients is not duly, defined. So this is the area we can research, we can promote the things.
सर, ये जो डोपिंग इंडिया में हो रही है, बहुत से जो ग्राउंड लेवल पे जो प्लेयर्स है वो अनएजुकेटेड प्लेयर्स होते हैं, उनको इतना नॉलेज नहीं होता कि कौन सा मेडिसिन बैंड है, कौन सा मेडिसिन बैन नहीं है. मे भी हो सकता है, बट बहुत से प्लेयर को तो नहीं होता है ये. और इसमें सबसे मेजर रोल प्ले करता है कोच का. जो पास्ट में प्लेयर्स थे जिन्होंने डोपिंग करके या जिन्होंने वो सब कुछ करके आज कोचेस बने हैं, आज जो प्लेयर्स है वो कल फ्यूचर में जाके कोचेस बनेंगे. तो ये सिलसिला तो चलता ही रहेगा. तो इसके ऊपर और कितना स्ट्रिक्ट प्लान ला सकते हैं और इसको कैसे एथिकली करेक्ट कर सकते हैं?
ऐसा नहीं है. मैं तो ये कहूँगा कि एजुकेशन प्लेज अ वेरी इंपॉर्टेंट रोल, एंड दिस इज़ नॉट अ सिंगल रिस्पॉन्सिबिलिटी, दिस इज़ आवर कलेक्टिव रिस्पॉन्सिबिलिटी to address this challenge basically. And with regard to the penalty and the punishment, as you have seen that one of the anti-doping rule violation category, the coaches and the athlete support personnel are also equally responsible if they found guilty of promoting any unfair means. And recently there have been incidences in past that NADA has punished and taken the action against the coach or the ASPs who involved in this kind of promoting unfair means. So this was all about that we can collectively impose and make the audience aware about the, the guidelines and the procedures, so that to avoid inadvertent doping violation. And of course, you all know that at present we have an act passed by the Honorable Parliament, and that called the National Anti-Doping Act. So there are so much, teeth and authority and the powers has been given to the NADA to control this doping menace. So later on, we can see the improvement and hope for the best. Yes.
Sir, good afternoon, sir. जितना भी अपने पास में इंफ्रास्ट्रक्चर है अभी तक नाडा का, so should we need to expand it? What is your view on that one? Is it covering in a healthy manner all the aspects? Because most of the time the violations find the loopholes, or not, the agencies are not covering holistically. So that's why the anti-doping violations happen. तो इसको हमें बढ़ाने की ज़रूरत है.
फिर से आप बताएंगे क्या? पार्डन, पूरी तरह से मैं नहीं समझ में.
सर जैसे लेबोरेटरीज़ है, इसके अंदर जितने मैन पावर है उसको हमें और ज़्यादा बढ़ाना चाहिए इंडिया के अंदर.
Definitely, we have a scope of improving the human resources and all, and technology-wise and the human resources-wise, because the WADA is now day to day. I mean, they are coming with some new guidelines, some standards. So we have to adopt. We have to be compliant to the WADA guidelines and the standards. Like for the 2027 code, you can see there is splitting of IST, international standard for testing and investigation to two separate standards. One is IST, standard for testing. Another is international standard for investigation and intelligence. So definitely, WADA is promoting to have more and more intelligence gathering, investigations, search and seizures to deter the doping activities. So definitely, higher authority and the top management and the policy makers, they are doing in that way to have some more and more, staffs and the resources.
Thank you, sir.
Hello, sir. Thank you. My question is, are there any initiatives taken in educating coaches about doping in India? And if yes, what are the initiatives?
Yeah. We are conducting so many dedicated programs for the athlete support personnel, including coaches, doctors, and other physiotherapists of the athletes, ecosystem. So it is in our by default program. We are conducting so many programs.
Sir, there is one suggestion from my side that has anti-doping agency has had any partnership with Indian Medical Association. I suggest that it should be mandatory at the ground level, like district championship and state championship, for every participants in every sports to go through some kind of tests that gives them positive results, and then only they participate at the national level. For that, you need to have some kind of partnership with lab testing agencies at city levels where state championship or district championships are held.
See, we have one of ex-director of the National Dope Testing Laboratory sitting with us, Dr. Alka Botra, and she can discuss in her tomorrow's session also and now onwards also that this is a very challenging task for any laboratory to meet the WADA standards. So first of all, every testing cannot be taken place at every competition, and due to stringent guidelines being followed by the laboratories. If laboratory is unable to complete or compliant to those guidelines adopted by WADA, then the WADA have a sword on their neck and all, and they can be declared non-compliant. So for the purpose of addressing this issue that you are talking about, the district level, state level competition and the training camps, NADA is collaborating with the state authorities and the respective state association of the federations for promoting the anti-doping education program, awareness program at grassroots level. Because WADA standard also clearly says that athlete first experience with regard to the doping control has to be through education rather the doping control. Or athlete is just going to give the samples to the authority and he is knowing what is the doping. So we have to first educate the athletes, make them aware, sensitize the parents also and the coaches and the stakeholders. Then we can promote for the sample collection and all. And also that there is a limitation for the laboratory also to conduct the analysis, and every district competition and the state competition cannot be covered. Even in the Olympics, you can see that all the athletes are not going to be tested in every Olympic or major events. So this is for the measure of the population and the percentage which needs to be conducted for the doping control. And your second point, that collaboration with the IMA or the NMC at present, National Medical Council, we have been collaborating with them for sensitizing the medical practitioners of the country. I mean, not for the purpose of the collecting and analyzing the samples for the detection of substances. We have been collaborating for sensitization of medical practitioners, because sometimes we have seen that the athlete himself does not disclose that he is a sports person. He is going to the doctor, taking the treatment, and the doctor unknowingly prescribe the prohibited medicine to that particular athlete. And as a result, if the athlete tested, then the adverse findings come. So there is a sensitization has to be done for the medical practitioner or the PhD level who are promoting or prescribing any medicine to the athletes, so that the therapeutic use exemption requirement, which is a portal by the WADA for the use of any prohibited medicine by any athlete on the medical grounds, on the legitimate medical condition. So we are working and we are doing that.
Good evening, sir. Sir, India's current anti-doping policies in line with WADA's education-focused framework.
Can you please come again?
Sir, India's current anti-doping policies in line with WADA's education-focused framework.
Yeah, of course. We are compliant to WADA and we are trying to best, adhering to all the guidelines and the standards adopted by the WADA.
Thank you, sir.
Any further questions?
गुड हेलो सर, जैसे डोपिंग में 2 साल 4 साल का और 8 साल का बैन है, उसके बीच में आपने एक बताया था लाइफ लॉन्ग टाइम भी एक बैन लगता है, तो वो कौन से क्राइटेरिया और वो कौन से डोप्स आते हैं उसके अंडर जिसमें लाइफ टाइम बैन लगता है प्लेयर्स को? और साथ ही सर, अभी तक नाडा ने किसी ऐसे इंडियन नेशनल लेवल पे किसी एथलीट को बैन किया लाइफ टाइम?
जी हाँ, बहुत सारे केसेस हैं, आप देख सकते हैं वेबसाइट पर लिस्ट हमारे पब्लिश है। और लाइफ टाइम प्रोविज़न का उन केसेस में है सैंक्शनिंग जहाँ पर मल्टीपल वायलेशन होता है, मीन्स रिपीटेड वायलेशन। द एथलीट हैज़ वायलेटेड वंस द एंटी डोपिंग रूल्स, punished for the 2 years or 4 years, whatever it was, and then the same athlete has reinstated in sports, re-participated in any competition or training camps after the completion of the ineligibility period first awarded to that athlete. And again, second time he got tested and violated the anti-doping rules. Then this second sanction comes and there is a provision of 8 years to lifetime of sanctioning to that particular athlete, those who repeat the violation.
थैंक यू सर.
Are we
Any
done
more
with the
question?
questions now?
Or we are waiting for the coffee or tea break?
I now request Mr. Avinash Kharel, Dean, Rashtra Raksha University campuses, to kindly come to the stage to felicitate Dr. Ankush. Thank you, sir. Thank you, Dr. Ankush.